Hi, public health students. We're continuing this series on gratitude and looking at the science and research behind how gratitude actually helps improve health outcomes. This week, I want to look at a study that was published from the University of California, Berkeley, with researchers from the University of Indiana. With this study, what they did is they were really curious because a lot of gratitude studies are done on very healthy people, which is fine, but they wanted to look at people with low levels of mental health, specifically with anxiety and depression. And so what they did was they found a group of 300 adults getting ready to enter counseling sessions for either anxiety or depression. Then what they did was they took those 300 adults and they randomly assigned them to 3 groups. So that's important to note that it was random assignment because that helps reduce bias in outcomes. With those 3 groups, they took the first one and they had their counseling sessions, and as part of it, they had them write letters of gratitude. So they had to think about specific moments that they were thankful for and even the people tied to those moments and write letters about them. In the second group, they were writing about negative thoughts, right? The opposite. And then in the third group, it was the control group, so they weren't guided one way or the other. After 4 weeks of this practice with counseling, they saw improvement in mental health levels in the gratitude group. But after 12 weeks, they saw significant improvement in mental health levels in the gratitude group. They noticed more positive emotions. They noticed that they used words like we instead of I. So thinking of that outward focus and thinking of others in community and not self and isolation. And I just find that so fascinating that they saw such improvement. And so the researchers were really happy that it kind of had that snowball effect where after 4 weeks they saw improvement, but after 12 they saw so much more. So it's just another study that helps us see the benefits of gratitude and really cultivating that as a practice, whether you struggle with mental illness or not, because it can really help improve all of our health outcomes. Next week, we're going to actually continue diving into this study because the researchers took it a step further. And they took these same 3 groups and introduced a new activity and did MRI brain scans. And so we're going to look at that next week.